The Agency for Healthcare Administration would like to take this opportunity to welcome you and provide you with an overview of the Florida Medicaid Assistive Care Services Program. In this training, we will also review and compare the differences between the Assistive Care Services Program and the Assisted Living for the Elderly Waiver and how to avoid duplication of services. Eligible Medicaid recipients must reside in a qualified assisted living facility, or ALF, adult family care home, or AFCH, or residential treatment facility, RTF, and be provided scheduled and unscheduled care by the facility on a 24-hour per day basis when needed by the recipient. The Medicaid Assistive Care Services is a state-planned program that provides care to eligible Medicaid recipients, individuals who require an integrated set of services, and individuals who require services on a 24-hour per day basis. Let's talk very briefly about the Medicaid program in Florida. Medicaid is a program designed to help low-income people receive necessary health care services. The Title 19 Medicaid programs are state-administered programs funded by both the federal government and state governments. Each state administers their own program under federally approved individual state plans, and federal Medicaid laws mandate certain benefits for certain populations. The services provided must be available statewide in the same amount, duration, and scope. The purpose of the Medicaid Assistive Care Services Program is to promote and maintain the health of eligible recipients and to minimize the effects of illness and disabilities in order to delay or prevent institutionalization and allow the individual to continue to reside in the community for as long as possible. Now let's talk about who can receive assistive care services. First and foremost, individuals must be Medicaid eligible and must meet all of the following criteria. Must be 18 years or older. They must have a health assessment arranged by the facility that indicates the medical necessity of assistive care services, and the health assessment must be completed by a physician or other licensed practitioner of the healing arts, which is defined as a physician assistant, advanced registered nurse practitioner, or registered nurse acting within the scope of practice under state law. Also, the recipient must be determined to need at least 2 service components provided under the Assistive Care Services Program based on the health assessment completed by the physician, and must also reside in a Medicaid-enrolled assisted living facility, residential treatment facility, or adult family care home. The following individuals may not receive ACS. Institutionalized Medicaid recipients residing in institutions such as nursing facilities, state mental hospitals, institutions of mental disease, or intermediate facilities for the developmentally disabled. Individuals who participate in any Medicaid managed care program where the capitated payment is designed to cover all Medicaid services, and recipients who receive services in the ACS facility during the day but do not reside there. Eligible Medicaid recipients must have, at a minimum, the following functional capabilities. Must be ambulatory with or without assistance, does not exhibit chronic, inappropriate behavior that disrupts the facility's operations or is harmful to self or others, is capable of taking medication with assistance, does not have any stage 3 or 4 pressure sores, and does not require 24-hour nursing supervision. Assistive Care Services provides an array of services on a daily basis, which are provided by or administered through an enrolled ALF, AFCH, or RTF. The following components may be included in the Assistive Care Service Plan: health support, assistance with activities of daily living, also known as ADLs, assistance with instrumental activities of daily living, also known as IADLs, and assistance with self-administration of medication. Let's take a closer look at the components. First, we'll talk about the health support component, which is defined as requiring the provider to to meet the following objectives for the recipient. Observe the recipient's whereabouts and well-being on a daily basis. Remind the recipient of any important task on a daily basis. And record and report any significant changes in the recipient's appearance, behavior, or state of health to the recipient's healthcare provider, designated representative, or case manager. Next, providing assistance with activities of daily living, or ADLs, which is defined as providing individual assistance with one or more of the following activities: ambulating, transferring, bathing, dressing, eating, grooming, and toileting. If the health assessment indicates a need for ADL assistance, the ACS provider must provide assistance with at least one ADL daily in order to meet the required objectives for this component. The next component is the assistance with the instrumental activities of daily living, or IADLs, which is defined as providing individual assistance to the recipient with one or more of the following activities: shopping for personal items, making telephone calls, and managing money. The final component is the assistance with self-administration of medication, and it is defined as assistance with or supervision of self-administration of medication at least daily in accordance with licensure requirements applicable to the facility type. All of these components make up the array of services that may be included in the Assistive Care Services Plan and are administered by the Medicaid provider. Now that we've discussed the components of assistive care services, let's talk about when the start date begins for the services. The implementation of assistive care services for an eligible recipient may be provided and billed by the facility from the first day of the need for services, as long as the plan of care is being developed and is completed and documented as required. If the recipient's need and eligibility for ACS begins with the recipient's admission to the ALF or AFCH or RTF, then the initial assessment requirement is the same as the initial assessment for the facility type. If the need and eligibility for ACS begins after admission to the ALF, AFCH, or RTF, the assessment will follow the same procedure used for the reassessment and must be completed prior to billing for ACS. The initial assessment requirements for ALF residents are provided in Rule 58A-5.0181 Florida Administrative Code, and for AFCH residents are in Rule 58A-14.0061 Florida Administrative Code. If the need and eligibility for ACS begins with admission to the residential treatment facility, the initial assessment completed according to Rule 65E-4.016 Parent 9 Florida Administrative Code meets the assessment requirement for ACS. Now we need to talk about the required documentation of the initial assessment. The assessment provided by the facility and conducted by a physician or other licensed practitioner of the healing arts must document the need for at least 2 of the 4 ACS components. An assessment completed by a registered nurse for the Comprehensive Assessment and Review for Long-Term Care Services, or CARES program, will meet the ACS assessment requirement if a copy is maintained in the resident's file and it documents the need for at least 2 of the 4 ACS components. The following items are also mandatory types of documentation that must be in the recipient's case file. First, along with the assessment requirement, all recipients receiving ACS must have a certification of medical necessity for Medicaid Assistive Care Services, which is the ACA Med Serv Form 035, revised July 2009. This form can be found in the Appendix B of the Florida Medicaid Assistive Care Services Coverage and Limitations Handbook. Second, the Resident Service Plan for Assistive Care Services, which is the ACA Med Serv Form 036 as of July 2009, must be completed and available in the recipient's case file at the facility. And third, the Resident Service Log, which is ACA Med Serv Form 037 as of July 2009. Now, let's discuss the annual assessment. Recipients receiving assistive care services must have a complete assessment at least annually by a physician or other licensed practitioner of the healing arts, or sooner if a significant change in the recipient's condition occurs. Also, please remember that an annual assessment must be completed no more than 1 year plus 15 days after the last assessment. An assessment triggered by a significant change in the recipient's condition or case must be completed no more than 15 days after the change. It is also important to note that along with the annual assessment requirement, all recipients receiving ACS must have an updated certification of medical necessity for Medicaid assistive care services, which is ACA MedServ Form 035 as of July 2009, signed by a physician or other licensed practitioner of the healing arts, and the Resident Service Plan for Assistive Care Services, which is ACA MedServ Form 036 as of July 2009, completed and available in the recipient's case file at the facility. Every ACS recipient must have a service plan completed by the ACS service provider. The Resident Service Plan for Assistive Care Services, which is ACA MedServ Form 036 as of July 2009, and shall be used for each recipient receiving ACS. The form must be included in the recipient's case file at the facility. The ALF, RTF, and AFCH are responsible and are required to ensure that the service plan is developed and implemented. The Service Plan Development Plan involves the following 6 principles. First, individuality, addresses individual needs and preferences. Second, accountability, specifies who is responsible for providing service. Third, outcome orientation, identifies the expected outcome of the service provided. Fourth, completeness, addresses all of the identified needs in the health assessment. Fifth, input, resident must be consulted and agree with the plan. And sixth is staffing, complete guides to staffing and the facilities. The Resident Service Plan for Assistive Care Services, ACA MedServ Form 036, must be completed within 15 days after the initial health assessment or annual assessment. It must be in writing and based on information contained in the health assessment. The service plan must include the following elements: identifying information, which should include the facility name, resident's name, Medicaid identification number, and date. Services that address all of the recipient's needs identified in the health assessment. A list of the assistive care services that will be provided on a daily basis. Assistance with at least one ADL by the provider if the health assessment indicates a need for ADL assistance. The level of functioning and assistance needed. The service provider's information. The expected outcome of service. A signature and date by a facility representative and the resident, guardian, or designated representative, and updates to the plan when conditions change. All of the necessary ACS components must be specified in the recipient's resident service plan for assistive care services and documented using the ACA MedServ Form 036. The facility service plan approval requires 2 signatures. For an ALF, the facility administrator or person designated in writing by the administrator must sign. For an AFCH, the provider who is the licensee must sign the service plan. And for an RTF, the administrator or person designated in writing by the administrator must sign. The service plan must also be signed by the resident, except in the following situations. If the resident has a legal guardian, the guardian must sign the form on the resident's behalf. Or, if the resident has a representative designated in writing, the representative may sign the form on the resident's behalf. The resident's representative may not be an owner or employee of the facility. The service plan is considered complete as of the last date signed by either party. As we continue, let's talk about the service documentation for the resident. The ALF, RTF, or AFCH must document that the recipient received services in the facility on each day for which ACS is billed. The service documentation must be made on the Resident Service Log Form for Medicaid Assistive Care Services, which is ACA MedServ Form 037 as of July 2009. In addition to the records required by the applicable licensure standards, ACS records that must be kept include all of the following: copies of all eligibility documents, the health assessment forms, ACA Form 1823 or ACA Form 3110-1023 or AFCH-1110, and reassessment forms. You will also need to include the certification of medical necessity for Medicaid Assistive Care Services, ACA MedServ Form 035. The record will also need to include the Resident Service Plan for Assistive Care Services, ACA MedServ Form 036, and the Resident Service Log, ACA MedServ Form 037. This documentation must be maintained at the facility, kept for at least 5 years, and be made available to the Agency for Healthcare Administration, monitoring or surveyor staff, or its designated representative upon request. As a reminder, all of the ACS paper documentation must be legible. If the documentation is handwritten, then it must be written in blue or black ink. No erasures or whiteout are permitted. In case of an error, the ALF administrator or designee, AFCH provider or RTF administrator or designee must line through the error, initial and date it, then make the correct entry. The ACS documentation may also be submitted in electronic format. The original signed, if applicable, documents must be kept in the recipient's case file in the facility in chronological order for audit, monitoring, and quality assurance purposes. If electronic format is used, backup files must be kept and maintained by the provider. To continue our discussion, let's talk a little about the leave of absence and/or discharge of a recipient. As a reminder of our previous discussion regarding eligibility for ACS recipients, Medicaid recipients must reside in an ACS-enrolled facility in order to receive ACS services. A recipient that is not a resident of an ACS-enrolled facility will be denied ACS services even if all other eligibility criteria are met. A recipient may be terminated from ACS under some circumstances when moving from one facility to another. Recipients must be advised of their rights to appeal these actions when they occur. Leave of absence from the facility. Recipients may leave the facility for more than 24 hours from time to time for health or personal reasons. During such periods, assistive care services are not being provided and may not be billed. Assistive care service discharge requirements. If the ALF, AFCH, or RTF representative initiates discharge of an assistive care services recipient, the discharge must be done in accordance with the licensure requirements applicable to the facility type. There are other recipients who may qualify for the assistive care services. The Assisted Living for the Elderly, or ALE waiver recipients who receive optional state supplementation, or OSS, may also receive assistive care services, provided the waiver and ACS component services are not duplicative and that the services are listed on the ALE plan of care. We previously mentioned the Optional State Supplementation Program, which is administered by the Department of Children and Families. What is the OSS program, you ask? The OSS program provides cash assistance to help low-income recipients with room and board payments in assisted living facilities. Recipients should contact the Department of Children and Families in order to apply for this program. Okay, now let's talk a little about the Assisted Living or AL waiver. The AL waiver is a home and community-based services program that provides extra support services to eligible Medicaid recipients living in assisted living facilities, or ALFs, licensed for extended congregate care, ECC, or limited nursing services, LNS. Medicaid reimburses ALF providers for home and community-based waiver services provided to eligible Medicaid recipients who are enrolled in the Assisted Living Waiver Program. AL waiver services must be rendered by qualified, enrolled providers pursuant to a written plan of care that is developed as a result of detailed assessment of the recipient's condition and service needs. Because services are based on the individual needs of each recipient, not every recipient receives every service. Please note and remember that the AL waiver services are provided based on a written plan of care which must be documented in the recipient's case file. Recipient enrollment means being determined financially and medically eligible for the waiver subject to the availability of respective Department of Elder Affairs, or DOEA, Department of Children and Families, or DCF, and the Agency for Healthcare Administration, or AHCA, waiver funds. In addition to meeting Medicaid eligibility, participants in the waiver must meet all of the following criteria. AL waiver recipients must demonstrate functional deterioration that would result in placement in a nursing facility were it not for the provision of AL waiver services. And they must be 18 to 64 years old and determined disabled according to the Social Security Administration, and individuals 65 years and older. Also, Florida residents that meet nursing facility level of care criteria are eligible for the AL waiver services, as well as individuals who are deemed appropriate for ALF placement by the facility administrator. Furthermore, individuals who are moving out of a nursing facility or other institutional program may be eligible to receive the services. Individuals who are already residents of an ALF but need additional services in order to remain in the facility may be eligible. Others who may be eligible to receive the services are individuals who have been living at home and determined at risk of nursing facility placement and have a desire to move into an ALF. Individuals who meet one or more functional criteria as described in the AL Waiver Services Coverage and Limitations Handbook. Have a case manager employed by a waiver-enrolled case management agency. Medicaid recipients must also meet at least one of the following functional criteria to qualify for ALs as well. The recipient must require assistance with 4 or more ADLs or 3 ADLs plus supervision or administration of medication. They must require total help with 1 or more ADLs, and or they must have a diagnosis of Alzheimer's disease or another type of dementia and require assistance with 2 or more ADLs. Or the recipient must have a diagnosed degenerative or chronic medical condition requiring nursing services that cannot be provided in a standard ALF but are available in an ALF licensed for limited nursing or extended congregate care. Or they must be a Medicaid eligible recipient who meets ALF criteria and is awaiting discharge from a nursing facility placement and who cannot return to a private residence because of a need for supervision, personal care, periodic nursing services, or a combination of the 3. Before we begin to talk about the level of care requirements for the AL waiver, it is important to know that all applicants for AL waiver services must be assessed to meet the nursing home level of care. The level of care reviews are performed by the Comprehensive Assessment and Review for Long-Term Care Services, also known as CARES program, in the Department of Elder Affairs. Let's talk now about what services are covered under the AL waiver. All AL waiver recipients must receive case management and assisted living services. When reviewing the recipient's level of care needs, remember that all AL waiver recipients' receipt of incontinence supplies is based on that need. The services are based on the recipient's needs and must be documented in an approved plan of care. AL waiver services are provided by qualified, Medicaid-enrolled waiver providers. Case management is provided to all assisted living waiver participants. This case manager will identify, organize, coordinate, and monitor services needed by the individual recipient. The case manager also assists the recipient to assess any needed services. When the recipient's case manager reviews the case file, They must ensure that the facility provide those services. If the recipient is assessed to need certain service components, the facility will also provide an attendant call system, attendant care, behavior management, chore services, companion services, homemaker services, and intermittent nursing. Other services included in the ALS components are medication administration, occupational therapy, personal care, physical therapy, specialized medical equipment and supplies, speech therapy, and therapeutic social and recreational services. Now let's talk about some important distinctions and relations between the Assistive Care Services, or ACS, and the Medicaid Assisted Living, or AL Waiver. ACS is a Medicaid state plan service that allows AL Waiver providers to provide extra services to their waiver recipients who are receiving Optional State Supplementation, or OSS. If ACS is being provided, it may be billed along with the AL Waiver reimbursement for OSS clients. Remember that ACS is not an AL Waiver service. All Medicaid handbooks, fee schedules, forms, provider notices, and other important Medicaid information are available on the Medicaid Fiscal Agent's web portal at http://mymedicaid-florida.com. Again, that's http://mymedicaid-florida.com. From the website, please click on the Public Information for Providers. Then click on the Provider Support link, which is located at the left-hand side of the screen in the Providers section. Under Provider Support, you may choose from a variety of options that include provider handbooks and fee schedules. On the Public Information for Providers page, go to the right side of the web page, under the Quick Links, and click on the Florida Medicaid Healthcare Alerts subscription link, or you can go directly to www.ahca.myflorida.com/Medicaid/alerts/alerts.html and register there. Complete the online form. A confirmation email will be sent to your registered email account to avoid fraudulent subscription requests. Subscribers must return the confirmation email in order to complete their subscription. Periodically, the State Medicaid Office will communicate to the provider community via provider alert messages. Provider alerts typically contain new policies and/or pertinent Medicaid information relevant to the provider community. This webpage contains recent and historical Medicaid provider alerts, so visit this page often for current updates and monitor your registered email account for the latest information from Florida Medicaid. We hope that this information on assistive care services has been informative. We thank you for your time and look forward to providing you with more learning opportunities.